Welcome to today's talk by Paradox Society on the active cycle of breathing. Active cycle of breathing technique. The agenda for today will be the talk on that ACBT in short, followed by question and answer. Please post your questions on the chat box, mute your microphone, and unmute only when asking questions. Please turn on your camera so that we can see each other, and the session will be recorded. Disclaimer: the information provided is for general information purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician for any health problems. Non-affiliation disclaimer: not affiliated to any product that we are going to mention today. So ACBT is about airway clearance, active cycle of breathing technique. When do we need to clear the airways? Is when there's a lot of phlegm and sputum in the airways, clogging the airways, making breathing difficult, and maybe even causing desaturation of oxygen in the body. So what are the causes of excessive phlegm? Acute bronchitis, chronic bronchitis as in COPD, bronchiectasis, pneumonia. There may be clear phlegm or even colored phlegm, sometimes even with blood in it. So the excessive phlegm causes several problems. First is airflow obstruction. Secondary, the excess mucus in the airways will encourage overgrowth of bacteria and colonize the airways. If they multiply too rapidly and the immune system of the person is not that good, they can even cause lung infection. So there are several ways to clear the airways. First of all, today we will discuss about ACBT. Previously, we have discussed about postural drainage techniques. In future, we will talk about autogenic drainage. And there are several devices which one can purchase, like PEP devices, positive expiratory pressure devices, auxiliary PEP devices like the Aerobica, the Flutter, or the Acapella, and other devices which is like high frequency chest wall oxygenation, which is a vest, mechanical insufflation, exsufflation, which is a machine which is also known as a cough assist. Not so commonly used is the intrapulmonary percussive ventilation. And of course, very commonly, we also prescribe mucolytics to liquefy the phlegm, make it more easy to come out expectorated. Active cycle of breathing technique. It is a cycle consisting of relaxed breathing, deep breathing for several times, relaxed breathing again, and huffs to bring up the phlegm. ACBT can be done sitting down or lying down. The first component is relaxed breathing. This is diaphragmatic breathing, breathing using the diaphragm, or abdominal breathing, which is relaxed, gentle breaths are created. So what happens is that it prevents airway spasm, collapse of the airways, and also helps recovery from breathlessness, especially after several huffs and coughing to expel the phlegm. So essentially, relaxed breathing is diaphragmatic breathing used to prevent airway collapse and also recovery from breathlessness after a bout of huffing and coughing. Deep breathing is like taking a deep breath, holding for 3 seconds, and then breathing out. So what happens when we do that? It expands the lung fully and improves ventilation. So like here in this diagram, you can see the air goes into this airway lumen and goes down to the airways and to the alveoli. The air gets behind the accumulated mucus, helps to loosen it and mobilize the phlegm. Air goes in through here, and then when one exhales, it will mobilizes the mucus in the opposite direction. It also improves ciliary function and prevent atelectasis, which is collapse of the small airways of the lung. So this is a cartoon of the mucociliary escalator. As you can see, the cilia in the airways. These cilia are responsible for bringing up the phlegm because of their movement, sweeping movement upwards. And here you have a video of the cilia moving. Okay, you see the cilia moving. Final component is the huff. These are deep breaths in, and then with your mouth open and the glottis also opened, that is not to tighten the throat. Air is forced out using the abdomen, using the diaphragm, and we call it huffs. Huffs cause less airway pressure and spasm than coughs. So because we are huffing, the airway does not collapse as much as in coughing. Uncontrolled cough the airways actually collapses and is not good for drainage of the phlegm. One can liken that when we squeeze toothpaste out of tube, you can imagine when we huff, we actually squeeze the airways. And as the air is being expelled out, so is the mucus. So this compressive movement during the huffing and the force air out at the same time, the mucus will move upwards. So that's why it's important to use this technique to bring up the phlegm. And it's also the technique used in PEP devices and also the auxiliary PEP devices. And what is this controlled cough? So once the phlegm reaches the upper airways, we would like to cough it out. There must be sensation of this phlegm in the upper airways, like in the throat. It's a deliberate staged cough. This is known as a controlled cough. So how is it done? A deep inhalation, hold the breath for 1 to 3 seconds, and then cough out using the abdominal muscles. Now you can put the palm of the hand over the abdomen, and as you cough, you can push back the abdomen, and that will produce a good cough. Questions: when do we do ACBT? Whenever there's phlegm. The phlegm can occur with us even when we have a cold, a common cold. And so ACBT can be used in any occasion whereby there's excessive phlegm. Of course, it can be used when there is disease as well. The next question would be, how many cycles? Well, one should do it as often as possible, several times a day. And once it is done, one must feel that the airways are clear. You can feel the sensation that the airways are clear, and then you can stop. And of course, one must not do it until one is breathless or very tired. So there's telltale signs that one should stop doing. Take a rest and repeat it later. These cycles can go on for several minutes in a session, and also one can have several sessions in a day. When to stop? When one is breathless, or one is coughing out blood, or one is very tired. So for certain diseases like bronchiectasis, it should be done lifelong. These diseases continue to produce phlegm daily. For people who are breathless and also have borderline oxygen or low oxygen saturation in the blood, oxygen supplementation will be useful. That means to say, have a home oxygen concentrator, turn on the machine, and use oxygen while performing ACBT. You can bring up the oxygen saturation to about 95% and above while doing the ACBT. So what happens when one coughs out blood? If it is fresh blood, one should stop, especially if it is moderate to large amount. But if it has been stale blood, those dark brownish blood, one should continue, but be careful with the cough. The cough should not be too excessive or too hard in a sense. So it has to be controlled coughing so that the blood clot covering the previous bleed in the airways will not dislodge and cause further bleeding. What about during infection? During infection of the lungs or the airways, there will be more phlegm. So during this period of time, the technique ACBT should be done or used more frequently until the phlegms are all cleared and breathing becomes better. So thank you very much for your attention. I hope the information is useful for bringing up whoever has phlegm in the airways. Thank you and good night.